The frustration that that mother feels is something a lot of parents of kids with autism can understand. It can be difficult to find schools and staff that understand how to work with kiddos that are facing different challenges. But oftentimes, the first steps to helping a child starts at home with an early diagnosis. I want to bring in two people who know a whole lot about helping kiddos with autism. We're joined by Dr. Jim Sears of AskDrSears.com and Laura Kasbar. She is the mother of twins with autism and is the author of Embracing the Battle. And I think that's part of the importance of it, is embracing,
yes, it
embracing
is.
your reality, right?
Absolutely.
Well,
yes.
let's talk about the first part I know that during Autism Awareness Month, the important thing is diagnosis, right? The early signs. Can you give us a list of things people can be on the lookout for?
Oh, sure. And it's important to get those signs recognized early. You know, if your child isn't speaking or smiling by age 6 months, no babbling by 9 months, no words by 16 months, those are some of the big signs. And Laura actually has put together a great video that actually shows the parents the signs to look for. Because when you see them, it's much harder to kind of
parents are anxious, especially if it's your first. You know this very well.
In denial.
And sometimes in denial. You've got anxiety and denial together. But you have to put on your big girl panties and say, okay, what's realistically happening here?
This video shakes the denial away.
Does it?
Yes.
Oh, I've started sending it to all my patients that are younger. For their parents to watch.
You've been through it. You know what it feels like to understand that something's happening outside of your control. Because as a parent, you're trying to control chaos, right? But you realize that that is now happening. And I think there's a lot of things that go on inside your own head. Self-blame and denial, all of those things.
Absolutely. Like as you said, my twins were diagnosed when they were 3, and my son didn't respond to therapy. So I invented a whole new type of therapy for him called discrete video modeling. And with that, he caught up to his peers in language by the time he was 8 years old. Both he and his twin sister went to college at 16 years old.
They're 21 now.
They're 21. They have jobs. They're independent. And Gemiini is a web-based platform that was created to deliver this truly life-changing therapy to people around the world.
The point is to not make it a stigma. For there's been so little information, Dr. Sears, about autism, and there's been some conflicting pieces of information out there too.
There's a lot of debate out there, but what there's no debate out is starting treatment early can make all the difference in the world.
Why is that?
It's because a younger brain is more adaptable, and a lot of the therapy for autism is essentially training the brain to reroute itself around those faulty neural pathways. And an 18-month-old brain is so much more adaptable than even a 3-year-old's or a 4-year-old's. So losing that potential 2 years of therapy and retraining the brain can make all the difference between that child eventually mainstreaming into a regular school, graduating with all his friends and having a normal life versus being institutionalized.
Because that's the big, you're at home and you've got the right tools. So you're there at home and you know what to do, but you're sending your kiddos out into the world. And the world hasn't necessarily caught up to the knowledge, right? And that can be a real point of concern for parents.
A lot of people who don't know see autistic behaviors as rebellious or misbehaving or bad parenting.
Yes.
In fact, do you know that for years, decades, autism was blamed on cold mothers, that they literally thought it was just all about parenting. We know that's not true now, but still that perception is out there, and people don't have a lot of empathy if they don't have it in your life. So,
do you feel like we're making strides?
Oh yes, because of Big Bang Theory and The Good Doctor and all this with high function. TV helps a lot, and now we have YouTube. People can go on and talk about their challenges. Still, there's this misperception about children's behavior. If you have a child who does not understand basic commands like stop, sit down, don't run. Basic words, you can't expect them to behave.
This is a mother of 7. She knows what she's talking about.
You know, I've met her kids. I can't even tell which ones are autistic.
Isn't that incredible? Has the medical community caught up?
We're making strides. You know, the problem is there's not one identifiable cause. You know, so it's a variety of genetic and environmental factors that somehow play a role. And so, you know, I'm looking forward to the day we can finally figure it out.
You and I both, all 3 of us are in agreement there, and I know there's many out there. Well, we wanted to commemorate that it is Autism Awareness Month, and we wanted to meet a mom who's in the struggle every day and succeeding and is helping others, and Dr. Sears, who's been so helpful as well. Thank you so much, Laura. Dr. Sears, good to have you both here.
Thanks, Michaela.
Thank you very much.